Well, let's talk a bit about who the personnel are behind pharmacology. In other words, who are these folks? Let's talk first about a pharmacist. A pharmacist is the healthcare professional who manages a pharmacy and who dispenses medication. These folks work in all kinds of pharmacies. They provide personal assistance to customers, they provide consultation and counseling, and they are involved with physicians and registered nurses in medication therapy management. Working alongside the pharmacist is what's called a pharmacy technician. Now, this is an assistant who performs pharmacy related tasks under the supervision of a pharmacist. They can fill prescriptions, they can label those prescription bottles, they can stock the shelves of the pharmacy, they can give instructions to customers that they are essentially reading verbatim from either the pharmacist or the medications themselves. Now, the pharmacy technician works under the direction of the pharmacist and directs all drug related questions to the pharmacist. In other words, if I ask, how does this medication lower my blood pressure? If I ask that to a pharmacy tech, they would say, let me get you a pharmacist, because that's all about how the medication works. If I were to ask, how many times or when do I need to take this medication? A pharmacy tech can answer that by reading the label or referring to the pharmacist and saying something like, this should be taken at night or this should be taken 3 times a day. All pharmacists require licensure, and all pharmacy personnel also require licensure. So the pharmacies must be licensed by the state, and the pharmacists must have a doctorate in pharmacy, that is a PharmD. And also, on top of that degree, they also need to take a test and qualify for a state license. Pharmacy technician must pass a national certification examination and then also be licensed by the state. An important component of all of these pharmacological concepts is what's known as patient education. And this goes back to a concept from medicine known as informed consent. Informed consent means not only do I give you permission to do something to my body or give me something for my body, but it also means that I have knowledge and understanding of what it is you're going to do to me. When we talk about medication education or drug information, this is part of informed consent. In some cases, this will be a verbal teaching from a pharmacist, but in a lot of cases, these mean things like pamphlets, in handouts, in readouts. These are given to the customer for free, and they explain what the medication does, what it's designed to do, and many of the adverse, that is, unwanted effects that may occur, and if those do occur, what the patient should do about it.